Stay tuned to hear about the latest procedures in plastic and reconstructive surgery. I'm Marilyn Priel with The Better Part.
Welcome to The Better Part, a program that encompasses a diverse spectrum of topics important to our community, which we hope will both inform and entertain you. We invite you to sit back and enjoy the program.
Our guest served for over 20 years as part of the clinical faculty at Stanford University. He now has a practice in San Jose, California. Please meet the prominent reconstructive and plastic surgeon, Dr. Vincent Lepore. Welcome, Dr. Lepore.
Well, thank you, Marilyn, for having me on your program.
Now, you've pretty much now are doing cosmetic surgery, but you've been over the years done a lot of reconstructive surgery for, I guess, accident victims and this sort of thing. So maybe we'll talk about that first, some of the things that are going on and can be done with reconstructive surgery.
Yes, Marilyn, when people hear the term plastic surgery, they often think of cosmetic surgery, facelifts, tummy tucks, liposuction, and certainly as a plastic surgeon I do a lot of that. But plastic surgeons are also involved in reconstructive surgery. When we speak of reconstructive surgery, we're talking about trying to make a person normal after they've had some sort of a trauma or problem. That may be a congenital problem or a birth defect, such as a cleft lip, a cleft palate, a congenital hand deformity, a congenital cranial or skull deformity. It may be surgery to help correct a problem from an accident, such as a major burn, where we may consider doing skin grafting, or an accident in which we have to repair a laceration, a cut, fracture of the face. Also, we get involved as plastic surgeons when there are major problems such as amputations, and we have to put amputated limbs back on.
Actually, you were doing quite a bit of that at San Jose Hospital, weren't you? Putting fingers and things like that, reattaching.
Yes, for about 15 years I was the co-director of our microvascular and replantation service. And since San Jose Hospital was a trauma center, we would see all types of traumas. But the skills that we have in doing those kinds of procedures can be carried over to reconstructive surgery elsewhere, and even to cosmetic surgery.
I even know a lady who told me that her nose was almost partially taken off in a car accident, and you would hardly know it to look at her. They seem to be able to put things back together pretty well.
Yes, if the tissue is still viable and we can find a reasonable blood vessel or a good-sized artery or vein, often we can replace the tissue that was lost. If the tissue is too badly damaged, then we have to borrow tissue from elsewhere in the body to reconstruct that missing part.
So would that be what they call skin or fat harvesting or transfer, that sort of thing?
Yes, it would be what we would call a flap type of procedure, where we're taking skin, subcutaneous tissue, muscle, or bone, or a combination of all of those, and refashioning it to reconstruct the missing part.
Well, they must have a lot of new techniques and equipment these days. Is there something that maybe the general public doesn't know about, like maybe instead of stitches they use tape or
yes.
something?
Well, first of all, the general public is very aware these days, and I would say half of the time I find out about some new treatment or instrument, not through my medical journals or my colleagues, but from my patients who have gotten online and have seen something new. That being said, there's always new treatments, new instruments coming to market. And some of the interesting things that we see now are different types of, you mentioned suture. There's a suture that's specifically designed with little barbs in it, And instead of having to tie knots every so often, as you pass the suture through the tissue, it catches the tissue and actually holds the tissue as if you tied a knot. So that's one of the new things that's out in recent months.
Well, now I know that you do a lot of reconstructive surgery for women who have had breast cancer. And can you tell us how that works?
Yes, I work very often with a number of general surgeons in the community who, for purposes of breast cancer, will need to do mastectomies. There are a number of good options for breast reconstruction after mastectomy, and often, at least the first stage of the reconstruction can be performed right at the same time when the mastectomy is done. Basically, there's two general categories of reconstruction. One would be with the use of some type of an implant. The implant can be put in, as I said, at the same time as the mastectomy. There are a couple of different types of implants, and I have some here. Typically, when we do the initial stage of breast reconstruction, we'll put in a specific type of an implant called a tissue expander. And I have one here. This is a typical tissue expander. It can be filled with saline or salt water, and it has a metal filling port in the implant. And the implant can be put in under the chest muscles, partially filled. The reason we can't put a fully filled implant in is because we're short of tissue in most cases. So we'll put this implant in under the chest muscles, and then a period of time, about 2 to 3 months after the surgery, we in the office will pass a little magnet over the skin, find the metal filling port, and then pass a hypodermic needle through the skin into the implant and gradually fill it to stretch the overlying skin and tissue to make a breast. And then at a second stage, we'll take this implant out and put a more natural feeling implant in, such as this, that may be filled with salt water or silicone gel.
That's really nice. And then is there any way of building a breast without using any implants at all?
Yes. The other major option for reconstructing breast tissue is to use one's own tissue. We refer to it as autologous tissue. And that tissue can come from almost anywhere in the body, and there have been many, many different types of procedures described to reconstruct the breast with one's own tissue. Probably the most common tissue that we're using these days is the lower tummy tissue, the skin, fat, and a portion of one of the muscles in the lower tummy. That may be referred to as a TRAM, or T-R-A-M flap, because it's based on the transverse rectus abdominis muscle. Now that tissue can be taken out of the body. This tissue is often thrown away when we do a tummy tuck, but we can basically use that thrown away tummy tuck tissue to make a breast, and it can be brought up to the chest, either pedicled on a muscle, or it can be taken completely out of the body, brought up onto the chest, and under a microscope we will hook up a artery and a vein to give it blood supply so that it can survive.
That sounds a lot more extensive, probably.
It is. My colleagues and I recently did such a procedure, and it was about a 10-hour surgery.
I can see how a woman might feel better, though, having her own body after she'd been through some trauma, to just have her own body in there. It just seems to me, but
I think patients really appreciate the fact that they're on the road to recovery and making them whole. So I think that most patients, from a psychological standpoint, do much better if we can get them as whole as possible as soon as possible.
And do you do any procedures that are specifically for men?
Yes, we do. Probably the most common procedure that we see is for feminization of the breast, what's clinically known as gynecomastia. Men have breast tissue just as women do, and when men go through puberty, the breasts can develop just as they do in women, and sometimes they don't involute or regress as the young man gets older, and it can be a source of embarrassment to him. So there are procedures that we do to help reshape the man's chest, remove that excess breast tissue.
Probably a lot more men coming in even for facelifts because this age thing that's gone crazy. You know, to keep a job almost, you have to look 25 or 30 years old now.
Well, I hear this not only from men, but women also, that because of the job market, because of the youth orientation of our society, they want to look as they feel. And people are working later and later into their years, and they want to look as fresh as they feel. So that's true. Patients come in for touch-ups to project the image that they want to project. And I would say in that regard, probably the most common procedure I see is facial rejuvenation. And of the different facial procedures that we do, blepharoplasty or eyelid surgery is probably one of the most common.
For men especially, I
for men,
suppose.
but and women as well, yes.
And that's just removing some of the fat out of the lids and some of the skin as well, I guess. Huh?
Yes, so it involves removing the excess skin from the upper and lower eyelids, removing some of the excess muscle from those lids, and also some of the surrounding fat. We can also even reposition the eyelid corners, again, to make a more youthful appearance.
And then a lot of Asian people like to have the fold in their eye. Do they do that anymore?
Yes.
Is that
Oh,
still
yes,
done?
we do that. Again, that can be done by removing some of the fat in the upper eyelid and stabilizing the skin to an underlying cartilage membrane in the eye to give more of a fold to the upper lid.
And then what about noses?
Many people, when they think of rhinoplasty, think of somebody who has a large nose or a hump on their nose, and want to reduce the size of the nose. But in a significant number of patients who have a smaller nose or a flatter bridge, we actually have to add and augment the nose to make it larger. So in many patients of Asian descent, they will come to augment the nose. And we have implants such as this that are silastic or rubberized implants that can be placed through a very tiny incision. In fact, this implant I usually place through a very small incision inside the mouth. So we lift the lip up, make a little tunnel under the bottom of the nose and over the bridge of the nose, and then place the implant like this. And the patients can come into the office and choose the different types of implants they would like to have placed.
And you have little pictures that they can look at and see what they want to do.
Yes, so I do show patients before and after pictures of similar patients so that they can get an idea of what to expect.
And you have some chin, some things that look
Yes.
like, are those chins?
Yeah,
or-
these are sizers. The actual implants we put in are clear, so they won't look blue through the skin. But these are actually cheek implants that can go in the cheek. And then there are different types of chin implants, but I have a chin implant that can be placed through a little incision in the mouth to augment the chin as well.
I see. And does the tissue grow around them after a while, or are they firm after a while after they go in?
Yes, the body will form what we call a scar capsule around any implant we place, whether it's a breast implant, a nose implant, a cheek implant. So the body does form a scar capsule around it. Depending upon the surface of the implant may stay loose in that pocket or may actually sort of ingrow into the tissues. You can see I have two separate implants here. This implant is actually a saltwater filled breast implant, and it can be filled with a tube, but it has a smooth surface and this won't tend to stick in place. This implant is a silicone filled breast implant. It has a rougher surface, and the rougher coated surface implants will tend to stick in place. And depending upon the situation, we may want a smooth surface implant that moves a little bit, or one with a rougher coat that tends to stay in place.
But if you want the smooth one, it's going to be saline then, and then the rough one is
No,
silicone.
not necessarily. They make implants that are smooth or rough in saline and silicone.
So they're still using silicone then instead of the saline, or
We have both types of implants. I'd say the majority of patients who have augmentations probably still have saline implants, but in certain cases I may feel that the thickness of the silicone gel may be worth doing. So we may use a silicone gel implant in certain patients. And in fact, they've come out with thicker silicone gel implants that are less likely to be problematic if an implant were to break or leak.
I've heard of these 1 hour in the door and walk out 1 hour without any surgery, and you've had a facelift. Can that be true?
Well, there are all sorts of things that can be done to rejuvenate the face, and certainly there have been great advances in minimal procedures or non-surgical procedures. The face can be improved not only surgically by removing excess skin or tightening the underlying soft tissues or muscle, but it can be improved with surface procedures like chemical peels or laser skin resurfacing to tighten and rejuvenate the skin. One can use fillers such as Restylane, Juvederm, Perlane. These are the fillers that have sort of taken the place of collagen. They're all based on a protein, hyaluronic acid, that we have in our bodies, and those fillers can be injected into the nasolabial folds of the face, around fine wrinkles, around the lips, or even enhance the lips and make the lips larger. Also, there's Botox, or botulism, which is botulism toxin, that can be used to inject into small muscles of the face to help frown lines and even crow's feet area lines around eyelids. So sometimes doctors will refer to this as a 1 hour facelift, and to the extent that it rejuvenates the face, that's true. But is it an alternative to a facelift when somebody really needs a facelift? No.
It's not going to get rid of the neck problem.
Unfortunately, I see a lot of patients who come in who really need the facelift, and they're hoping that I have a magic wand, and I don't.
So. Not so. Well, and then we talked a little bit about the liposuction, and just briefly talk about that. Could you take a little fat out of somebody's tummy and put in their face instead of using some of those other?
You can, and certainly we do that. Now the fat doesn't tend to have as good consistency as some of the fillers, and so for very fine areas in the face, I still prefer to use the fillers. However, I do fat transfers to larger areas, and what's become very popular now, what some people in the lay public refer to as the Brazilian butt lift, is actually a procedure where we do liposuction on one area of the body where there's excess fat, and then we emulsify the fat and inject it into the buttock to make the buttock fuller, and that's become very popular in the last couple of years.
Actually, there's another thing that you have that reduces fat without actually doing the liposuction and pulling the fat out, and that is something called Zerona?
Yes, this is a new treatment that's just come out in the last year or two. Zerona is a low-intensity laser light treatment. The best way I can describe it is it's very similar to going to a tanning booth and lying under the tanning lights. Only in this case you're lying under laser lights that are specifically designed to, the laser light penetrates the skin and stimulates the fat cell under the skin to break down its own fat and causes the fat cell to open up little pores and expel the fat into the circulatory system, and it's then processed in the liver. The treatments usually take about 40 minutes to do. Usually we'll suggest at least a package of about 6 treatments, but we've had patients have 9 or 12 treatments. But the treatments are usually separated about 48 hours. So a package of 6 treatments will be done over a 2-week period. So patients will come in once every other day for about 40 minutes and lie under the Zerona lights. And in most cases, patients will lose anywhere from about 3 to 9 inches in combined circumference in their waist, their hips, and their thighs. So if someone's interested in shaping the waist, hips, or thighs, doesn't want to do an invasive procedure, the Zerona is a nice alternative.
And doing it in the segments protects the liver. Then.
Yes, with any procedure, there are what we would call contraindications. So if somebody has problems with high fat levels in their blood or lipid in their blood, then they may not be a good candidate for the Zerona.
And then you have something over here called Latisse that I have seen Brooke Shields on television advertising about growing eyelashes. And,
yes, actually,
it's so popular now. I think you have to touch on it.
Yes, Latisse is a prostaglandin hormone that was accidentally discovered. It was a medicine that was actually originally designed to treat glaucoma, and it does treat glaucoma. But the ophthalmologist discovered that when they were treating the patients for the glaucoma, that their eyelashes were growing long, dark, and luxurious. So they've remarketed it as the first product to help eyelashes get thicker, longer, and more beautiful. And they also it also works on eyebrows. So it's a product that you paint on the surface of the eyelash, and over a period of 6 weeks, will make the eyelashes grow much thicker and longer and darker.
I see more and more dermatologists advertising facelifts, and I've seen ear, nose, and throat. I saw in one man's office would do rhinoplasties, the nose surgery. Is that common, that kind of things the field is moving into other specialties? Or?
Yes. Plastic surgeons are not the only surgeons or specialists who perform cosmetic procedures, and physicians in other specialties do cosmetic work. So it's not unusual to see a dermatologist who injects Botox or Restylane or Juvederm, and certainly they do chemical peels. ENT doctors, or ears, nose, and throat doctors, are trained and can do rhinoplasties, and I know of several who do very nice rhinoplasty work.
Limited to their area of expertise.
Hopefully, yes.
What's it like having worked at a university hospital as compared to a private hospital?
Yes, well, I did my training at Stanford, and I also did some further training at Dartmouth-Hitchcock University Hospital at Dartmouth in Hanover. And certainly a university setting is an excellent place to train. You get to work with some of the top people in their field. You're on the cutting edge of research. You can participate in research that you otherwise wouldn't get to participate in a community hospital or in a city type of hospital. But that being said, the community hospitals that we have in the Bay Area here are excellent, and there's a lot of excellent work that's being done at all of the community hospitals around. So
well, that's nice to know. Well, when you were on the faculty there, did you actually lecture, or did you more teach during surgical procedures?
Yes, I was on the voluntary clinical faculty, so I was still in private practice, but having trained at Stanford, often residents would come through either my private practice and work with us, or we would teach or lecture. So in both cases, there would be physicians coming by and working with us.
It must be wonderful to have worked and known so many of the best doctors in the world. And you must be one of them, because you were accepted to the medical school there, and then they kept you on. So
I got by. But no, yes, they're excellent plastic surgeons in the area. And the one nice aspect of our program when I went through, and this has been 20 years ago now, was that a full year of our training allowed us to go outside of Stanford to train at other institutes or train with other plastic surgeons. And so the residents had an opportunity to go literally all over the world to train, and then they would come back for their senior or chief resident year and bring all the information they got from those other centers back to Stanford. So it really fertilized the program very well, and that's how I ended up spending time at Dartmouth-Hitchcock.
Well, you must have access then to all the latest technology and in your field.
Oh, yes, certainly by having been associated with Stanford and Dartmouth, I have access to that. But with modern day technology, and especially the internet, physicians, even if they aren't located near a major medical center, now can really have access to cutting edge information and research almost anywhere in the world.
I understand you met your wife through plastic surgery. Can I tell who your wife is?
It's okay with me if it's okay with her.
He's married to the beautiful Maggie Skura, the veteran television anchor person and host. And she was telling me that her boss lost a finger. And I guess you put it back on, and that's how she met you.
This is true. My partner and I had just started practice in San Jose some 20-odd years ago, and we were setting up our microvascular surgery center at San Jose Hospital, and we were starting to do this type of work that previously was really only done in university settings. And one of the local anchors had come by and had done a little piece on our team. And I joked to my partner that I said, well, you really haven't made it in San Jose until you've been interviewed by Maggie Skura.
Really?
So lo and behold, not a week or two later, I got called down to the emergency room to see a gentleman who had amputated his finger working on a home woodworking project. And when I got down there, I found this fellow surrounded by people with KMVT t-shirts on. And I thought it was a joke at first, but it wasn't. It was Maggie's boss who had amputated his finger. And so my partner and I put the finger back on, and we befriended each other, and he introduced me to Maggie.
Oh my goodness, that's a love story.
And he was our ring bearer at our wedding.
Really? Well, that's appropriate. That's appropriate. Well, thank you so much for coming to give us an education on what can be done to correct our problems and enhance our appearance. And I've loved having you, and I know everybody on the crew has enjoyed it as well. So thank you.
Well, thank you, Marilyn, for having me on your program. I appreciate it.